Now let us see how the infection can be controlled in the dental office. So if there is any infection, so how can we control that infection in the dentistry? So here, what is infection? So if there is any microorganisms depositing on a body surface, then it leads to the infection. So if for example, if a microorganism is there, it has entered into the body and it deposits on the tissues, and thereby the tissue growth or the tissue damage occurs. So then that leads to the infection, and the number of organisms which are able to cause infection is called as infective dose. So infective dose is nothing but how many number of organisms are there and how many number of organisms are able to cause the infection. And this infective dose or the infection, it depends on three aspects. One is virulence of the organism. Virulence is nothing but the ability of the microorganism to damage the cell. So how much capable the organism is there in order to damage the cell, that is called virulence. And susceptibility of the host. So how far the person is susceptible, or how far the person can fight against that infection. And age, pre-existing dose. So all these are make into considerations in order for the, in order we can say whether the person is infectious or not. How can we control the infection? So we need to prevent the spread of the infection. So what is this infection control exactly? So whatever the microorganisms are there, so we need to prevent. So we need not allow the microorganisms to spread more so that the infection can be controlled, and we need to kill or remove the microorganisms, and thereby the infection won't be spreadable. Why the infection control is important in dentistry? So here in the dental office, we need most of the things which are there. So the person or the patient who can come to the doctor, the patient may have various sort of infections. So here the patient as well as DHCP is nothing but the dental healthcare personnel. So patient as well as dental healthcare personnel can be exposed to various pathogens. So here, because they are exposed to various pathogens, then the infection need to be controlled. And here the dentist may come in contact with the blood as well as the saliva or oral fluids of the person. So because of that, which is the fastest mode of transmission. So that is the reason the control has to be made, and proper procedures can prevent the transmission of these infections. What are the objectives of infection control? So why the infection control is needed exactly? So in order to reduce the available number of microorganisms. So if the more microorganisms are there, we need to either kill, destroy, or we need to at least reduce or prevent the spread of microorganisms and interrupt the spread, break the cycle of cross-contamination. So we need to stop the contamination there itself. We should take proper care in order for the microorganism to spread or to contaminate, and treat all clients and clinicals or all clients and clinicians as if infected. So whether the person is infected or not, so we need to give a proper care. We need to use sanitizers, we need to use Dettol. So whether if a patient is infectious or not, so we need to treat them as if they are infected only. And protect from exposure. We need to protect the person from the exposure to microorganisms. So what are the various infectious diseases which are concerned in the dental practice? So one is viral infection, bacterial infection, fungal infection, and parasitic infection. So if we see what are the various bacterial infections that are prone. So here the microorganism like Neisseria gonorrhoeae, which is spread through inhalation, and Treponema palladium, which is also spread through inhalation route, Mycobacterium tuberculosis, which is spread through inhalation route or inoculation route, and Streptococcus pyogenes, which is spread through inhalation route. Now, if we see the viral infections have the CMV virus, which is spread through inhalation route, and hepatitis virus, inoculation, and HSV virus, which is spread through inoculation, again HIV virus, that is human immunovirus, through inoculation, measles virus, measles, mumps, influenza, rubella, and adenovirus. So these are all the viruses which are spread through inhalation route. So we need to take care, and we need to make sure that we are not inhaling, or we are not breathing that infected air in order to prevent us from the infections. So the fungal infections, mostly spread fungal infections are through Candidiasis species, and parasitic infection is through Pneumocystis carinii. So this is the most, we can say this is the most spreadable parasitic infection. So what is cross infection? So cross infection is nothing but from the patient, contamination can be spread through the doctor or clinician, or from the clinician it may spread to the patient, or it may spread from patient to patient also. So here there are chances of the person breathing, the person exhaling out the microorganisms out, or the person may splash his droplets, mouth droplets, or the person may sneeze or cough, and thereby the if the clinician is not taking proper care, and the person may breathe, a clinician may breathe that air where the infection is spreading from the patient to the healthcare personnel, or it may spread from healthcare personnel to the patient as well. Or if a healthy patient is there and infected patient is there, from the infected patient it may spread through healthy patient. Let us see the chain of infection. So here, from the susceptible host, from the host organism, the pathogen may enter into the healthy personnel, or from the source infection, and from the source it may spread through various mode of infections, and thereby the microorganism will enter into the healthy person. So it is a chain. First, the microorganism stays in the host cell, and from the host cell it enters into the healthy organism through various modes of infection. We have to break this chain. So how we can break this chain, or what is the chain we have to break? Here, infectious agents. So there are various infectious agents like bacteria, virus, fungi, and parasites. So these infectious agents, they enter into the reservoirs. So the reservoirs may be people, environment, or water. So these microorganisms, they enter into the individuals, or they stay in the environment, or they stay in the water, and they make them as a reservoir. And from there they enter into, they may portal of exit, they enter, or else if for example take one person, he is carrying the microorganism in him, from him the portal of exit is through the excretion, secretion, skin, as well as droplets. So through all these sources the microorganism will come out of that person, and it will enter into the other person through various mode of transmission, like direct contact, if the person comes in direct contact with the healthy person, or if the person sneezes or coughs, through the air droplets the infectious agent can enter into the healthy person. And portal of entry into the healthy person is through mucous membrane. So if there is any cut or injury on the skin, through that cut the microorganism can enter, and respiratory system, broken skin, or GI tract. And from here the microorganism makes this person as the host to stay in that, and thereby from this person the infectious is spread. So susceptible hosts are the people who are unvaccinated, so who have not taken any vaccination, who have less immune activity, who has diabetes or surgery, burns, or cardiac related disorder. So all these persons are considered to be the host for the microorganism. So we need to break this chain, otherwise the infection will spread. So how does what are the factors which are influencing for the transmission of infection? So here, one is the source of infection. The person or the thing which is carrying the infection should be kept, make into considerations. Means of infection, how the infection is getting spread. Route of transmission, so how through which route the microorganism is entering into the body. And susceptible host. What are the modes of infection? So here the mode of infection is that direct, indirect, and airborne. So direct is that from the patient it may enter into the clinician, or from clinician it may spread to the patient, or from patient to patient, or it may be autogenous. And indirect is nothing but through formite. So formite is in the sense through skin cut, or if there are any bruises or damage to the skin, through the skin the microorganism is entering. And or else we can say formite is nothing but a substance which is carrying the microorganism. So a substance which is able to carry the microorganism, and thereby it is spread. And aerosol or droplet, so when we sneeze or cough, through that droplets the microorganism is coming out. So what is the risk of transmission? So mostly in a dental practice, the clinician will come in contact with the saliva of the patient. So saliva, body fluids, blood, as well as the other body fluids. So when the person or clinician will come in contact with the infected person, then the clinician has greater risk of getting the infection. And the transmission may be from dental personnel to patient, or patient to the dental personnel. So what are the tasks which are involved in the risk factor? So here the task that involved exposure to body fluids, blood and saliva. So the clinician will be exposed to blood, saliva as well as body fluids. That is a task for him. That is a challenging, from where the infection can be spread. And the other one is without involving the exposure to this. So the person is not exposed to body fluids, but even then if the environment is not clean, so the devices which we use are not clean, then through that the infection may spread. And the other task is that the person is not involved, or the person is not in contact with their body fluids or not. So it is spread through environment. What is the general principle of infection control? So what are the general principles which are involved in the infection control? So we need to identify the person who has the high risk to spread infection. So we need to identify that person, and we need to keep that person away from the hygiene environment. And universal protection is nothing but we need to keep ourselves clean and prevent environmental contamination. So we need to make our environment hygiene. And we need to make sure while using sharp instruments and needles, we need to make sure those instruments are sterile. And handling biopsy specimens. So biopsy specimens are nothing but the tissue specimens which are removed out of the body. So we need to handle them very carefully. And prosthodontic consideration. So prosthodontic is a branch of dentistry where it is involved in the designing, manufacturing or replacing the artificial teeth or mouth related organs. So this is a branch of dentistry which is dealing with. So we need to make these into consideration. While we are using this, we need to make into this considerations. And infection control during radiography. So if we are giving radiography, then the infection should be treated. And biomedical waste. So we use cotton plugs, and we use various gloves, and thereby these need to be these need to be discarded properly. So otherwise that may cause infection. So identifying high risk patients and source of infection. So how can we identify whether the patient is high risk for infection or not? So we need to understand the disease. So if a person is having any disease, so we need to identify the disease, and we need to identify the route of transmission for the disease. What is the cause of that disease or transmission? And the other one is we need to take the medical history of the patient. And because why we need to take medical history is that few diseases are such a way that they may come back, or even after the treatment the person may suffer with that disease. So we need to know the medical history of the person, and we need to screen new patients. So if the new patients are coming to us, then we need to review the patient regarding his past medical history and continue to update the patients with medical history. So what is universal protection? So here all infected persons, so if we observe the person physically, so if even the physical examination is done, so it's not that easy to say whether the person is infected or not. So that is the reason we need to prevent ourselves in order to spread of the infection. So infection control procedure followed routinely for all patients. So whether the patient is infected or not, so infection control procedure should be given to each and every patient. So what is the universal control? How universal protection is done? First thing is that hand hygiene. So we need to keep our hands clean. So hands are the most common mode of infection. So hands are the most common mode. That is the reason before giving treatment and after giving treatment, or before touching any chemical substances, we need to wash our hands before and after, and thereby the pathogen spreading can be reduced. And we need to wash our hands, and if the hands are visible to be dirt, then immediately the hands should be washed, and after touching the contaminated objects also, and before and after the patient treatment, the hands should be cleaned. So here the hands should be cleaned through normal water or soap solutions, or we can even clean our hands through alcohol based preparations. Those are nothing but the sanitizers. So here we can use sanitizers because they are rapid. They are rapid and very effective. They are very easy to use. So just we can take one drop of sanitizer, and then we can rub against our hands, and thereby our hands will be free from microorganisms and the improved skin condition, so that our skin won't be damaged or become dry because of overwashing, and more accessible than sinks. So we can use these sanitizers anywhere. There is no need for us to look for sink. But there are few limitations in order to use sanitizer, because if our hands are filled with soil, or if our hands are very dirty with mud, then we can't use sanitizers. Then definitely we need to wash our hands against water. And these should be stored away from high temperatures of flames. So they should be always temperature controlled. So if there is any high temperature or flames, then these are of no use. And hand softeners and glow powders may be built up. So here if we are using gloves, and if there is any powder to our hands, then we can't use this sanitizer. So it also has some limitations. So gloves and gloving. So we are using gloves. So how these gloves can be, gloves can be prevented, thereby to spread infection. So we need to choose the correct glove. So all the gloves should not be used for surgical treatment. So here we need to identify the correct glove. So we need to use sterile gloves. So if we are using gloves for surgery, then sterile gloves should be preferred, and the gloves should be examined properly, and the gloves should be mostly of latex, synthetic or nitrile based gloves, and we should use non-powdered gloves. So once the surgical treatment is over, so whatever the gloves are there, that should be kept in, that should be discarded in clean areas. So that, we need to keep, after the surgery is done, we should not keep the gloves anywhere. So we need to place them definitely in the proper medical waste bin. So otherwise, these may spread the infection. And the puncture resistant gloves for handling contaminated chucks. If we are using sharp objects or sharp instruments, if we are using, so we need to make sure that our gloves won't get punctured. And these are such a gloves which are made up of nitrile. So the other thing is that personal barrier. So what is the personal barriers we have to take care? So first thing is that eyewear, mask, face shield, gloves, attire and resuscitation devices. So face mask. So here face is one of the we can say one of the sensitive area which is more prone to infection, because here our nose contains mucous membrane, and if we breathe air through oral also it contains mucous membrane where the infection can be spread easily. So in order to prevent that, we need to put some face mask so that the infection won't enter into our oral cavity. And here we need to change the mask. So here we need to change the mask on regular basis. Protection eyewear. So here eyes are the also sensitive area. So once if a foreign particle enter into our eyes, that goes into systemic circulation very easily. So we need to wear proper eyewear during the surgery or treatment in order to prevent. So if a patient sneezes or coughs, so there are chances of that droplets falling or splashing into our eye. So in order to prevent that, we need to wear proper eyeglasses. Proper protective attire. So here what we have to do, there is some separate attire for surgical clinicians. So here we can't go as such to do any surgery, because so there are chances of microorganisms from us to spread to the patient or from patients to spread to us. So if a person is infectious and the person is carrying microorganisms, so if that microorganism sticks into our clothes and we are staying with our clothes for one whole day, so we are more prone to risk. So there is some special attire which is reusable or disposable, so that can be reused. We just use that attire for certain period of time during surgery and then we dispose it, or we can reuse it, or else we put it to the laundry and thereby it is sterilized. Education and training. So whoever the dentistry clinician who is there, or the dental person who is giving the treatment, he should be given proper education and training should be given how to reduce the infection. And there are various tools like organization for safety and asepsis procedures. So we need to follow the regulations under this, and SOP for each practice setting. SOP is nothing but standard operating procedure. So the dentist or clinician should know the standard operating procedure for each and every equipment which he uses, and resources. And approaches, like we need to train or teach the person in order to use the dental equipments. And medical waste. So medical waste is nothing but the gloves or whatever, like the cottons which we use to clean the oral cavity or blood of the person. So that has to be disposed properly. So if not, there are chances of spreading infection from this medical waste. So mostly the medical waste, normal medical waste won't contain any infections, but regulated medical waste should be there, that should be disposed very carefully. If not, there are a lot of chances to spread infection. And this regulated medical waste, whatever it's there, it should be kept labeled. In the sense, we need to label. So if the damaged tissue is there, for example, in a dental, you're treating any dental person, so if you remove any tooth of the person, so that is like, that is a regulated medical waste. So we need to put it, we need to label it properly. So this is the medical waste and this has to be disposed in a proper manner, so that whoever the person it may be, he may not open or he may not expose to that medical waste. And the medical waste are treated in accordance with the state and local EPA regulations. EPA is nothing but Environment Protection Agency. So whatever the regulations and guidelines which are provided by this agency, according to that regulations, the medical waste should be destroyed. And the process for regulated waste included autoclaving and incineration. So whatever the process which is used to destroy this medical waste is mostly through autoclaving or incineration. We completely burn the medical waste to ashes.